The Ministry of Health is advising members of the public who will be traveling to areas where chikungunya cases have been reported to take the following precautions to avoid being bitten by the Aedes aegypti mosquito, which transmit the disease. We need to use insect repellent on your skin. Sleep under a bed net. Spray indoors with insecticide to kill the adult mosquitoes. So if you're staying in a hotel room or whichever room you're staying in, spray it before, as we do here. You close it up, you spray, you go out for a little while, and then you come back in. That will kill all the adult mosquitoes. If you are so lucky to have an air-conditioned room, mosquitoes do not tend to live in them, but you can also spray your air-conditioned room. So you've gone and you visited, and you've come back home. We want you to consult your doctor if you develop any of the following symptoms when you return home to Barbados. If you have a sudden onset of fever, muscle or joint pains, headaches, or just feeling ill and loss of appetite. So these usually begin 3 to 7 days after being bitten by the mosquito, the infected mosquito. So depending on when you come back, if you come back and within 7 days, then if 7 days have passed, usually you're clear. You haven't developed it. And as Minister said, do not take aspirin, because aspirin will cause other complications like bleeding, which you don't want, okay? So basically we are saying we cannot put a travel restriction on anyone, but think carefully before you travel, and if you do travel, please take the precautions that I've just outlined.